Hi, I'm Emily Meisen-Sebelius, and I'm here with Wayne In and 12345 Fit-Tastic for our partner spotlight. And we have with us today Michelle Dake, who's the Director of Youth Initiatives at Casey Healthy Kids. Thanks for joining us, Michelle.
Hello, how are you?
I'm good. How are you?
I'm doing really good.
Well, thanks for being here today. We are excited to talk to you about your Champions for Health program and some of the adaptations you all are making to make it accessible virtually for students and for schools. So first of all, do you want to just tell us a little bit about your organization, Casey Healthy Kids, and sort of how the Champions for Health program came about?
Sure. So Casey Healthy Kids, we work to advance children and family health by using programs and policies to make it easier for families to practice healthy habits and have access to healthy food, access to safe places to play. And my role in that is to get kids involved and become champions or advocates for those type of things. So that's really how Champions for Health got started. It was adapting all the work at the policy level that Casey Healthy Kids was already doing and working to empower and give kids a platform to be involved in those same type of healthy community projects.
That's so neat. That's great. Having the kids involved and their voice coming forward, and that's so important. What are some of the key components of that Champions for Health program that you talked about?
So the main component is a curriculum that we developed 4 years ago, and there's 3 steps in the curriculum for students and teachers. And the first being learning healthy habits with 12345 Fit-Tastic. So you all have already a great health message, and we're so fortunate to be able to partner with you all and use that message as part of it. So students discover their healthy habits and they set a personal health goal. The second lesson is doing a healthy community investigation. So there's 8 indicators that we have them rate in the community. It's everything from the built environment in the community to school policies around healthy eating and active living, and they get a healthy community score at the end. Then the last step is actually speaking out for healthy kids. So there's letter writing activities. We have a Champions for Health challenge where students can earn some money for a student-led wellness project, but really it's taking those items that they identified in their healthy community investigation and things that are making it difficult for them to practice 1, 2, 3, 4, 5 Fit-Tastic and advocating to those adults what they need to be better.
That's great. That just really brings together, the messaging with the environmental changes and policies to empower students to achieve those messages. And then you guys do such a nice job of providing those platforms and ways to advocate. That's really neat to see that kind of full circle. How is the program going to look different this year? How will you be implementing it differently given the virtual nature of things?
Sure. So traditionally, we've always partnered with teachers in classrooms, and I would go in and I would train teachers and provide them with all the materials, and they would use it in their classroom. It's going to be a little different this year because not every teacher is physically with their students. So we developed Champions for Health online. So on Casey Healthy Kids website, instead of having the full curriculum, which is still available to download for teachers, that has the lesson plans, PowerPoint, student worksheets, like the whole kit and caboodle. We have just the essence of those 3 lesson plans available in a web form. So students can simply go online and they can do set their health goal with Fit-Tastic. They can do a healthy community investigation, and they can write a letter to decision makers in their community. And it's all online. It's all free. Students don't have to log in either and make an account. Really for our partner teachers, they can either share it as like an enrichment activity, or we also have a form for teachers if you want to receive the student work. They just simply fill out a form and the kids just type in their teacher's name, and then I'll be sending it back to our partner teachers so they can see virtually what their students are working on as well. So that's how the curriculum is going all online. Our Champions for Health challenge is each year we have a contest where students submit wellness projects that they're going to do, and it's all student-led. We're having that again this fall, and so it's always been online where classrooms submit virtually. It's just this year we're really expanding. It used to be pretty healthy eating and active living focused. And now it's more of like, what do you need? So even how do you do a student-led wellness project if you're virtual? So it could be anything from mindfulness to opportunities for kids to connect, cleaning supplies, more equipment for PE so they can all have their own set in class if they need it, so they're not sharing equipment. So really anything health, anything kids in classrooms need to thrive are fair game in the projects this year. So they just submit, they tell us about their project, how much it would cost, the problem it's going to solve, what adults are going to help them, and then they could submit 2 to 10 photos just kind of describing or showing us their ideas. So that's going to run all fall, and then winners will be awarded in the spring. The last new thing we're going to do is we do have a Facebook group. So similar to here, we're going to have guest speakers come on and where students in classrooms can ask questions. We started in May and then we took a little break over the summer. But in May, we had 2 presenters. We did a live tour of Split Log Urban Farm, and they got to see an urban farm in action and the greenhouse and the hydroponics. And then we also had Dr. Nancy Osborne lead a mindfulness activity for students called the Shark Fin. So we're hopeful to start that up in September again and have guest speakers from all the great partners out here in Kansas City who have something to share with students and they can ask questions. So it's all going to be just a little bit different, but hopefully still really engaging for kids and still giving them an opportunity to get their voices heard.
That's great. We will make sure below this that we have all the links for what you're talking about, the different components for students to log in and do their assessments of their healthy behaviors and their environment, and then the opportunities to log in and see about the challenge. That's really exciting. I know that students have put the challenge to good use in past years and been able to even get some funds to support their projects, which is really neat. So that's awesome that they still have the opportunity. And I love how you all are adapting it to really meet the needs of students, that it may look different this year, but there's still that opportunity to be thinking about how to be healthy, whether you're virtual or in person or something in between that. So that's really, really exciting. And we're excited to help promote that to schools and students too. Can you give any examples of some of the projects that students have done in the past, maybe some of those success stories from the challenge that could kind of spark our ideas as we're thinking about what that looks like for students?
Sure. The one you mentioned, the students have been able to secure additional funding. It always pops in my head. Academy for Integrated Arts. They had 6th graders who were graduating out of the school and submitted a project about adding a playground. They just got a new school building and it didn't have a playground yet. So they were donating the funds they won to the playground. And there was a community donator who was just a community donor who was just so touched by the idea that these kids wanted to build a playground for a school that they wouldn't be attending next year, that they went ahead and funded the full playground amount based on the student budget, which is incredible. We've had students do gardens. We've had them do walking clubs, start their 5Ks at their school. Last year, we had a group start a mindfulness corner so they could work on student stress, everything from PE equipment to even having more hygiene products in the middle school locker room. So girls are okay being sweaty and then getting cleaned up and looking cute going back to class. So I was just one of the more creative ones that, not necessarily adults don't always think about, but in a middle school mind, that's really in the front of their brain. So it was great.
That is great. And that's why it's so important for kids to tell us adults what they need to be active or to be healthy in their school, because it may be things that we don't always think about but are so important to them, and maybe things that the barrier is not that big. And so that's really cool, the wide range of projects from a playground to equipment, but being able to address all of those sorts of things to help kids be healthy and active in their schools. Is there anything else you want to tell us about the Champions for Health program as we wrap up today?
Really just that I am here to help. So if you're going on our website and you have questions, you can always email me. For our schools here in KCK and KCMO, I'm actually here to even do a virtual presentation. So if you want a virtual lecture or a guest speaker at your school, I'm here too. So I'd be glad to help, and I'm here to help with the challenge submissions as well.
Terrific. Well, thank you so much for your time today, Michelle. Thanks for sharing about this really terrific program. And we are excited as weighing in to support as well and get you all connected with students and schools for this wonderful opportunity. So thanks again for your time, and we'll be chatting with you soon.
Thanks, Emily.
All right. Bye, Michelle.